The learning framework was put together not just thinking about the first dementia strategy, it was anticipating the sequel, and we're now implementing the second National Dementia Strategy. And it really did look to the future. It's understanding that there are time implications, that people need time to learn and apply their learning to bring about some change. It is looking to the future and understanding that individuals can progress as they understand more and apply their learning more and just have a greater appreciation. They can grow more into their roles too. But it is based and rooted, part of the architecture really is the understanding human rights. That's incorporated throughout the learning framework.
So what I thought we'd do now is just get into some group work at tables, if that suits you all. So what we're going to do is just a nice wee exercise just to get familiarity with the levels, because some people will know them quite well, other people won't know them very well at all. So what we can do is, if you've got some paper, we can hand out some post-its, or just have it as a discussion. Look at the levels of knowledge and skills: informed, skilled, enhanced, expertise. And then think about all the roles that you can think about in social services or healthcare, maybe everybody in your office. Think of the roles they have. So service manager, admin support, gardener, driver. We're thinking about the whole range of roles in social services and health, or in the settings that you work in. And have a discussion and think about what level of knowledge and skills you believe would be appropriate for them to think about their learning and development. So I hope that was a useful exercise to do.
As well as the 4 levels in the Promoting Excellence framework, it ties in, it's all meshed around the 4 stages in an individual's dementia journey. And NES and SSSC didn't just dream this up. This is, again, based on background research, experience of those living with dementia, and the experience of other professionals. So in all of the resources, the material and the learning should address supporting and assisting an individual throughout their dementia journey. And we know it's challenging, and we know it can become difficult even for family members and carers to be supportive and care when they're struggling, as well as someone's progresses during the dementia journey. But what I would just highlight is, in your services, does your training needs analysis, does your individual development plan for your workers, for your staff and colleagues, does it reflect the dementia journey? And we hope that the Promoting Excellence framework will really help you meet that. Make sure that what you have is going to support an individual in their job role and help them. And the way also the material's been set out should be very practical and ideally help somebody to gather evidence that they can use towards an SVQ. And it's broken down in a way that will help you recognise somebody's knowledge, because, well, I could put a thought bubble up here if it was capturing this in cartoon illustration. But if you're observing something, if you're observing somebody's practice, the framework document, the booklet's worth a look through, because it sets out what a worker will be able to do, what they know, and also their capabilities and skills, and how you recognise, how you can record that you have seen this, and also then the outcome on the individual. And I suppose this is also where it's not meant to be another big ask from the SSSC, like registration. This is a supportive resource, And if an individual, one of your staff, or you have a group of staff progressing and working through, for example, with a very good psychological resource at the enhanced level, this is where you'll recognise the improvements in their practice. You'll be able to describe their knowledge, where somebody's gained knowledge, or even just break down in the terminology your own capabilities and skills. And this is drawn from the booklet, and the framework really is set out in that way. This slide shows and signposts you to a lot of our resources, and there's more. The materials get out of date so quickly. A lot of it is available online, and there's more since we put the slide together.